Hi everyone, welcome to researchmd.com. Today we're going to look at tennis elbow and the role of extracorporeal therapy. Is it beneficial based on the scientific principles? Again, at ResearchMD, all our recommendations or like our analysis are only based on science. We're not going to say if there is no science behind it or some studies to prove that. Again, my name is Pramil, Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and residents. I'm a director of research. And let's get into our subject. So, what is a tennis elbow? This is called a lateral epicondylitis, right? It's the micro tearing of the tendon that join the forearm muscles on the outside of the elbow. Okay, it damage from the overuse. That's why I repeated the same motion again and again. Just when you play tennis, that's the most common. The most common tendon is involved: extensor carpi, radialis brevis. And the other tendons are like extensor digitorum, extensor carpi radialis longus, and extensor carpi ulnaris. So epidemiology, around like 1 to 3% of the U.S. population. Large number of people are affected. And what is extracorporeal shockwave therapy? Like, is there a role? That's what, before we go into the role, let's talk a little bit about what extracorporeal shockwave therapy was actually developed in Germany and Bulgaria by some orthopedic physicians. Came from extracorporeal shockwave lithotripsy. We use it to crush the kidney stone like urologists use. And they found out it has help in the bone healing, angiogenesis, that means blood vessel formation near the musculoskeletal region. So it's, when you talk about shock wave, it's an acoustic wave. Okay, what is an acoustic wave? It's a three-dimensional fluctuation in the pressure field which travel at the speed of 1500 meters per second. Examples: you got audible sound from the speaker, ground movement from earthquake, and ultrasound used in the medical imaging. Physics, when you talk about, there's three different types of acoustic wave. One is shock wave, there's like diagnostic ultrasound, there's like a radial pressure wave. Today we're just going to talk only about the shock wave therapy. It's an acoustic wave and carries a lot of energy and can propagate through medium like solid, liquid. That's an example of a device. And energy measurement is done in energy flux density. You got low energy and high energy. So the next thing is we do literature search, find out a great study. We found this meta-analysis looking at the efficiency or benefit of extracorporeal shockwave therapy for lateral epicondylitis. And the objective of the study investigate the benefit of extracorporeal shockwave therapy in the lateral epicondylitis or tennis elbow. So design is a systematic review, meta-analysis. So when you talk about meta-analysis, they pull all the study together. So evidence is like on the high end, right? And then the results, if we can look at the diamond, it favors extracorporeal shockwave therapy without touching the line. So it's clearly it is beneficial. So based on this study, extracorporeal shockwave therapy can effectively relieve the pain and functional impairment caused by tennis elbow or lateral epicondylitis. Thank you so much for watching our channel. Thank you.